Hi, my name is Ailin. I'm a public health master's student at Cal State Long Beach.
Hi, I'm Nithershini Narayanan, and I'm an MPH student from Cal State Long Beach. So I've always had my interest to work for women and their health, and I heard about Iris Cantor-UCLA Women's Health Research Center through one of our professors back in Cal State Long Beach, and I saw all their programs and it was really interesting, especially working with lesbian and bisexual women.
There were a lot of projects going on that sounded very interesting and very different from the other organizations that I've been exposed to. So coming out of my comfort zone and then doing something that I think would help out a lot of community groups, it was like really meaningful, and I really wanted to dive into working on this.
So the three main projects that we work on is the Women's Health and Money at Work, the Lesbian and Bisexual Women's Health Collaborative, and also the Planning a Healthy Home, Body and Baby.
When we're preparing for these projects, we go visit the different sites where the program is being conducted. We take a look at the different population or the participants into that program, and we observed, and
we also get a better insight about how the health educators cater to different populations.
Hi, my name is Snigdha, and I'm a third-year psychology major at UCLA. I am someone who's very interested in healthcare administration and working with women and children, especially in underserved communities, so that's what really drew me to the internship at the Iris Cantor-UCLA Health Center. When I first reached out to Julie and she was telling me about the different aspects of the internship, I was really excited because it's such a versatile environment to be in. You're learning about the administration side, you're learning about the workshops that they do, the studies that they do, and how all of this comes together to actually make an impact on communities in LA that don't have the resources or the guidance that they need. And the really cool thing is that as an intern, you get to be a part of the planning process and helping see these conferences and workshops come together, and you also get to hear back from them and you get to see the feedback and what we can do to make it better. So you're really part of this growth and this movement, and I really like to see that my work in the program is making an impact on the community that I really want to learn more about and really want to help.
Hello, my name is Jasmine, Alberto. I am currently a senior at UCLA. I'm going to be graduating with a BS in Human Biology and Society, and I will be finishing up 2 minors as well, Applied Developmental Psychology and Public Health.
Hello, I'm Audree, and I'm a 4th year physiological sciences major and a food studies minor.
It was a great opportunity to see the other side of healthcare and a way to see the work that goes into putting these workshops and classes to empower women to seek out this help and know that there's resources for them.
I've also learned that there's a lot of more marginalized women than I thought, because I grew up very privileged in that I didn't have to worry too much about my health, but all the environmental toxins I've learned that are prevalent in Los Angeles, as well as the financial burdens and the stigma of for some women to have to come and to find help. It can be really hard for these women.
Yeah. So many other factors affect women's health. It's not just the mammogram or the breast cancer. There's work stress, the stress of raising their children, environmental toxins, and other things that make women vulnerable. So.
Hi, my name is Daisy Duran. I'm a 4th year majoring in Human Biology and Society. I became interested in interning here because I was looking for ways to get more involved and to do community work outside of school. And so I kept searching, and luckily I found this center. Going into the sites actually gave me a glance of community health work, which is something I'm interested in doing in the future, and just seeing the women learn and be really engaged in trying to understand how to eat healthy, how to manage their money well. I saw that there's a huge need and like educating others, specifically women, on these topics, because as they're and not only does it impact their lives but also their families and their communities. So it was really nice being able to see how these classes are making a huge change in other people's lives.